Joining me now to discuss the impact of the COVID-19 pandemic on other killer diseases in Nigeria is the chairman of the Medical Guild, Dr. Olujimi Shodipo, who's right here with us in the studio. Good evening, Doctor. Thank you for coming on the program, and compliments of the season to you.
Same to you. Nice to be here, as always.
All right. Now, just like you saw in that report, a lot of attention has shifted to the treatment of the COVID-19 pandemic, and this has led to a neglect of other major killer diseases. Now, with the second wave of the virus here, upon us in the country, what can be done actually to ensure that more attention is given to other critical ailments?
Well, thank you. Well, I think the first thing is we need to look at the lessons learned from the first wave. When we're looking at the ailments that have been affected by COVID, we have to, it's a broad spectrum. The report just focused a lot on some of the infectious diseases, malaria, tuberculosis, HIV, Lassa. Those four have been, major diseases have been affected. But we also need to look at the impact on non-communicable diseases, diabetes, hypertension, cancers. There was a time the system wasn't working very well because of all the pressure from COVID, and people couldn't even get a diagnosis. I know sometimes that could even make a difference between, are you dealing with potential cure, or are you dealing with a situation where it's palliative because it has spread. So I think some of the lessons we need to learn are, one, we can't shut down the system because of COVID. We need to make sure that the system keeps functioning. Two, we're seeing an increased number of cases. Where are the sources? Anytime we look at the reports, we see reports saying there are 300, 400, 900 cases coming in. We need to look at the data a little bit better. We need to look at, are these people, are the cases coming in from abroad? Because that is what has happened all over the world. They've seen that, for example, you have the new variants coming in from the United Kingdom. So if that is the case, how do we now stop at that point so that we don't affect the whole country, especially in a situation where you have, very limited resources? I'll just use the example of India. They also have a very, high migrant population that works abroad and come back during the holidays like Nigeria. So what they've done is they've tried to see where they can strengthen their quarantine services, isolation, and then ensure that people test by 5 days so that people don't get to spread, the virus. I know we've started that in Nigeria, but probably not being enforced. But the most important thing is we can't lose focus of the fact that beyond COVID, there are other causes of mortality. And even with COVID, what they've seen is people that have other disease conditions, once they're not properly managed, they are the ones likely to die compared to other people that, may have no other ailment. So we need to strengthen all that. And some of the services that were affected, for example, and it cuts across all age groups. We could start with children. Initially when COVID started, because a lot of the hospitals were not fully functioning, a lot of children could not get vaccinated, and they missed their immunization shots. And it's been difficult trying to get people to get to the level that they should be. For example, you have maybe a 10-week-old child that should have gotten a vaccine, didn't get the vaccine. Parents now finding it difficult to get that. So that is one angle. And then for other disease conditions too, we need to look at, one of the points that was mentioned was even funding. If you look at some of our programs like HIV, they are both donor-driven and also the government contributes something. A lot of the donors, because of the pressure back home of, healthcare and things like that, they're finding it difficult to be able to sustain it. So we need to look at it holistically and not make the same mistakes we made in the first wave, ensuring provide care during the second wave.
All right. Now, one other issue is the fact that many people are actually staying away from the hospitals because of the fear of contracting the virus from the hospitals. So how do health practitioners actually ensure people that there's really nothing to worry about?
Well, we've tried to look at it. I think the best way to look at it is in two ways. Number one is, first, we've tried to reassure people that, the hospitals are safe. A lot of people come into the hospitals. We're taking, you just aired, what happened today in Lagos when in the parks, people celebrating. I guess it's going to be more dangerous being in that park than coming to the hospital, because the hospital is still one place where everybody has to abide by a certain level of precaution, use of personal protective equipment, hand washing and things like that. So that's one angle. Of course, the second angle we've tried to do is looking at vulnerable populations and seeing that does everybody actually need to come. So for example, this has been an opportunity for us to test some of our e-medicine options. Things as simple as telephone consultations, ensuring that the hospitals are properly staggered to ensure that people come for their appointments just when it's necessary and not allow people to gather. But again, I think the first thing is to reassure everybody that the hospitals are safe. We have all the data coming out, and no data has really shown us that because somebody came to the hospital, the person was negative and then subsequently became positive and had a problem. No, most of the time, we've seen that anybody that's actually come in has gotten the virus from the community. And I think the hospital is the best place to actually be because they could access care. So I think this is just a clarion call. I still got that, message.
Right.
When we're in the clinic, people complaining that, I think this is COVID. And I said, well, we're all safe. And I think the hospital is still the safest place.
All right, we need to wrap up this conversation in just a bit. But before we do that, let me ask now, how do we attract more players into the health sector, owing to the fact that many health workers have also lost their lives to the pandemic?
Yeah, it's been quite sad, especially with the second wave. We've seen a high number of, especially medical doctors, some of our senior colleagues have lost their lives. And it just tells us that all of us need to be, we need to apply those precautions. We can't let our guards down. The second issue is, somebody mentioned the fact that how do we now key in as professionals and to ensure that we have a robust response. So I think we need all players to come in, pharmaceutical industry. Your report talked about the vaccines for other illnesses. They are driven by big pharma. So we need, local solutions. As has been mentioned, if a problem is not a problem of the United States, they're not going to invest money there. So we need government to invest in research and development. And I think this is another opportunity for us to look at the budget. For example, when we're talking about the 2021 budget, they're looking at about 7% of the budget as for healthcare. And that is just what is budgeted, not what is actually released. And we know that the African Union has advised that the minimum we should go is about 15%. So this is an opportunity for the stakeholders, policymakers to look at health as what is going to drive the economy. Because once you have a problem with health, you're going to have a problem with the economy.
Which is what many don't want. So I would like to thank you, Chairman of the Medical Guild, Dr. Olujimi Sodipo. Thank you for coming on the news.
Thank you for having me here. Thank you.